Welcome to Adapted Class. Pregnancy is very important, and the NCLEX love it when it comes to maternity and health promotion. You have to know about vaccine, medication they should avoid, teaching, education regarding how to protect the pregnancy, food, and all the things they should avoid infection. In this video, 13 questions to highlight that. Are you ready? Let's go. As usual, stop the video, answer the question on your own. Like I said, 13 questions highlighting anticipatory guidelines for pregnancy. Which of the following assignments should the nurse question or avoid, select or apply? What is the question is asking? A nurse recently tested positive for pregnancy. Which of the following assignments should the nurse question or avoid, select or apply? Administering chemotherapy to a client with cancer, providing routine postoperative care for stable clients, assisting with radiographic procedure involving X-ray without providing shielding, caring for a client with slap cheek rash, caring for a client with cytomegalovirus infection, and administering live vaccine to a client. What do you think? Stop the video, answer the question your own. But these are things the NCLEX will ask you. If you're pregnant, you should stay away from some of these information. Did you pick your answer? I'll show you what the question is asking again. So, avoid or question, and I'm pregnant. Which assignment should I question? Chemotherapy agent. Do you want to give a chemotherapy agent? Do you want to take care of a routine post-operative care patient? Do you want to do X-ray without shield? Do you want to take care of a patient with the slap cheek rash? Do you want to take care of a patient with the CMV infection? Or do you want to administer a live vaccine? What do you think? I know you pick your answer. I can tell you, chemotherapy agent, they are very teratogenic. They're toxic. You should stay away from it. Routine post-operative care patient is okay. If you're working with X-ray, you need a shield. Therefore, question this. Caring for a client with the slap cheek rash is what? Parvo B19, very infectious, teratogenic. Caring for a patient with CMV infection, also very infectious. These are what we call touch infection that a pregnant lady should avoid. A live vaccine. Giving a live vaccine is okay. It's not going to kill you. It's not going to cause any problem. You are just administering. It's different from chemotherapy agent. Therefore, those are the right answer. You can give chemotherapy, but you can give live vaccine. And these are the touch infections, and that's the explanation for that. Number one, down. Same thing, strategy, right? We're going through all the things they may ask you. Which of the following medications should the nurse advise the client to avoid or discuss with the provider? Select or apply. You don't have to pick everything. Pick those that you are 100% confident. A client with chronic hypertension is planning to become pregnant. Which medication should they avoid? That's all. There's specific medication you should avoid in pregnancy. Nifedipine, methadone, levodopa, propranolol, adralazine, losartan. This is one of the common questions that you see a bunch of mnemonic. Everybody have mnemonic. I'm not going to give you a mnemonic. I'm going to show you easy way to remember them. If you have mnemonic, stick with it. But these are medication for blood pressure. Which one the nurse should advise the patient to question or tell the provider to change it or advise against it? You stop the video, pick your answer, and let's proceed. You did yours already? Yes. Calcium channel blocker are the easy one, especially nifedipine. It's okay. This one is acceptable in pregnancy. Methadone is another medication good in pregnancy if you have blood pressure problem. Adralazine is good if you have blood pressure problem. Those are the three I want you to know: nifedipine, methadone, and adralazine. Let's come to the laws. The laws are troublesome because they will change it. Everybody know about levodopa, but let me show you something. There is a selective beta blocker and non-selective. Selective means they bind to B1, not B2. B2 is on your lungs because you have two lungs, right? So B2 receptor. So if you have any medication that bind to B1, B2, they are non-selective. Selective, usually are very good for pregnancy. So they are what we call the BAM, right? Bisoprolol, atenolol, metoprolol. They are very good for pregnancy. You can use them. They are selective. Non-selective are like nadolol, propranolol. They are non-selective, so you cannot use them at all. So propranolol is non-selective. Labetalol is a non-selective. But what is the problem? It has alpha effect and the beta. The alpha decreases blood pressure and the beta help with the heart rate and the cardiac output. And therefore, in combination of this, is better than pure what? Non-selective. So even though it has non-selective effect, that is the best law you can use for pregnancy. So that's why everybody know about what? Labetalol. So labetalol, nifedipine, metadopa, and adrenaline, they are the most common medication for pregnancy if you have hypertension. These four. Losartan is like ACE inhibitor. It causes renal agenesis. You should avoid it. And therefore, these are the medication. Some people call them LMN, and they have so many acronyms. But remember, nifedipine, metadopa, labetalol, adrenaline. If they bring another beta blocker apart from labetalol, see if it's a selective. If it's a selective, pick it. If it's non-selective, don't pick it. Therefore, what is the question is asking? Which of the following medications should the nurse advise the client to avoid? Advising the client to avoid, that means nifedipine is okay. Metadopa is okay. Labetalol is okay. Propranolol is not. Adrenaline is okay. Losartan is not okay. So those are the ones we should avoid in this patient. Therefore, that's the right answer. And nurse is performing medication reconciliation for a client who is planning to become pregnant. The same story. Which of the following medications should the nurse advise the client to avoid or discuss with the primary care provider? Select and apply. These are medications different from what we saw. What we saw is for hypertension. Now I'm giving you specific medication that has a bad effect. When you see this, this may be teratogenic. I never say hypertension. Therefore, all these medication, if it's teratogenic, pick it. Isotretinoin, methotrexate, lisinopril, atorvastatin, phenytoin, and levothyroxine. Which one should the client avoid because they are teratogenic? What do you think? You pick your answer? I know you pick your answer. Stop the video. Think about it. Which one is teratogenic? That's all the question is asking you. They are not the blood pressure medications, but you may see blood pressure medication there. But that's not the purpose of the question. Teratogenic. Isotretinoin is a teratogenic. Avoid it. Methotrexate is a cancer drug. Avoid it. Lisinopril is like ARB, causes renal agenesis. Atorvastatin is a statin. You should avoid it. Phenytoin is antiepileptic. You should avoid it. These are class of medication pregnant ladies should avoid. Levothyroxine, they should take it. You use it in hypothyroidism in patients who are pregnant. They need it. They cannot stop it. They may even have to double dose it. Therefore, those are the ones. And hence is reviewing vaccines with the client in their second trimester. Which vaccine is recommended during pregnancy? Same thing. What do you think? IM, influenza, MMR, varicella, HPV. What the question is asking you, rewrite it again. Which one is what? Non-live. Avoid live vaccine. HPV, avoid it. Varicella, live vaccine. MMR, live vaccine. Flu vaccine, oral. Nasal one is what? Live vaccine. IM is not. Therefore, we can pick this. And then she's teaching a pregnant client about breastfeeding. Which instruction should the nurse include in the teaching? Skin-to-skin contact immediately after birth promotes bonding. Is that true? Formula feeding should always replace breastfeeding. Is that okay? Breastfeeding has no impact on infant immunity. Do you think so? Lactation support is unnecessary. I know. This one is easy. It's common sense. You can pick it. And the NCLEX will give it to you. Some people will pick other answers. They feel like they're being trapped. You are not being trapped. I just give you the things that you know is the right thing. Don't pick something that you want to run away. You can see 4, D is wrong. Lactation support is needed. Not every mother know how to do it. Breastfeeding has impact on immunity. That's why we want you to feed the baby. You don't have to give the baby formula right away. So breastfeeding is needed, and it never replace breastfeeding. Therefore, skin to skin is very bonding, is the best way to stimulate breast milk. Which of the following is the most appropriate recommendation? And then teaches a pregnant client about sleep. You need to know how to sleep. Sleeping in pregnancy is very important. You want to know the best position. Lay flat on your back to avoid hip pain. Use the left lateral position for better circulation. Sleep only 4 to 5 hours per night. Avoid pillows for comfort. What do you think is the right thing to do for pregnancy? Go back to the pathophysiology. What is the main thing the question is asking? What is the best position to place the mother who is pregnant in what? In a third trimester to sleep. We don't want placenta insufficiency. Therefore, what is the right place? Laying flat, supine, never, never, negative. Lateral position, offload yourself from the inferior vena cava, blood flow to the placenta. A good move. Sleep only 4 to 5 hours. There's no time limit. You can sleep anytime you want. Avoid pillow for comfort. No, pillow will help you prevent reflux and pop yourself. Therefore, this is good. Which statement by the pregnant client in the correct understanding of mental health promotion? It's a physical problem, but your mental health is the most important. I should discuss anxiety and depression with my provider. Is that okay? Feeling stressed is abnormal during pregnancy. Would say so. I should avoid talking about my emotions to ensure a healthy pregnancy. I think that's the right answer. What do you think? The physical health is the most important right now. Who said so? Which one is your answer? Is there any trap you want there? Does that sound good to you? Don't pick it. The question said mental health. Pick an answer choice that answer it by mental health. That's the way you should answer question. The key word in the question is understand mental health. Therefore, if I'm talking about my anxiety, my depression, I'm talking about my mental health. 2 said, hey, if you're feeling stressed, it's what? Abnormal. It's not. There is a mental health issue associated with pregnancy. I should avoid talking about it. Why? We said we want to talk about it so that we can fix it before you develop postpartum depression. Physical health is the most important right now. The question said what? Mental health. So why do you want to pick physical health? Negative. 1 is the right answer. NS instruct a pregnant client on oral care. Oral problem is also a key aspect of your concept that you have to know. They will ask you, which statement by the client show correct understanding? I should brush and floss daily to prevent gum disease. 2, dental visits should be avoided until after delivery. Pregnancy protect against gum disease. I should use mouthwash instead of brushing. Stop the video, put your answer down, keep track of your score, and think about it. Gum disease during pregnancy. What do you know about it? Test taking strategy. Did you pick your answer? I will show you something. I know you pick your answer already. Excellent. Let's go. 1 said brush and flush daily to prevent gum disease. And C said pregnancy is going to protect you. One of these is the right answer. Dental fishes should be what? Avoided until delivery. Why? I should only mouthwash instead of brushing. You can see 1 is saying you should do both. And then 4 said, no, don't do that. Just do 1. Therefore, 1 of them has to be wrong. And then he said protect against what? Disease. This one said it does not. It prevents disease. This one said it protect against. Therefore, A, you can see, contain answer choice for C and D, and he's contradicting them. Therefore, test-taking strategy, I'm going to pick that because he has all the things in C and D. 1 question is comprehensive, is always the right answer. A pregnant client asks when she should call a healthcare provider. Disaster call, which symptoms indicate the need for immediate reporting. Selected apply. Don't pick everything. Pick those you are 100% confident and keep your score so that you don't lose a point. When you see bleeding, should you call me? When you're tired, should you call me? When you have severe abdominal pain, should you call me? If you have headache that does not go away, should you call me? If you have nausea, should you call me? What do you think? You know, the answer is obvious. If there's a problem, immediately prioritization, vaginal bleeding, call me. If you're tired, take some sleep. Severe abdominal pain, bad problem, abruption, right? Persistent headache, preeclampsia, call me. Nausea, acceptable in pregnancy. Which statement should the client avoid? Which substance should the client avoid? Select all that apply. And nurse is providing anticipatory guidelines to what? The pregnant client. Which one should they avoid about substance abuse? Tobacco, alcohol, prenatal vitamin, illicit drug, and moderate caffeine? It's a good question. They will ask you, you'll be there, and you know the answer. Don't run away from it. Smoking, placenta, abruption, alcohol, alcohol fetal syndrome. If you see these kids, their face and other problem they will have is so bad that you should not drink when you're pregnant. It's straightforward. Prenatal vitamin, you need it for what? To prevent neurotube defect. Drug, you should avoid it. Caffeine, you allow about 200 milligram per day, less than 200 milligram. Anything above that is not good. But this one are fine. A nurse is teaching a pregnant client about exercise. What do you know about exercise? How can you teach a parent who want to get pregnant about exercise? These are questions they will ask all the time. I should avoid all form of exercise during pregnancy. The question say exercise. Why should I avoid all form? You got to be active. Walking and swimming are safe exercise for me. Contact sports like basketball are recommended. I should exercise only during the first trimester. You pick an answer. You can exercise any trimester, so far as it does not involve contact sports that can cause injury during the third trimester. But swimming, aerobic exercise is your best move. Therefore, dance, aerobic, walk, all of them is acceptable. And nurse is canceling a pregnant client on proper hydration, drinking, which statement by the client indicate correct understanding. I should drink about 6 to 10 cups of water per day. We all need 2 to 3 liters of water a day. Which one is equivalent to that? I only need to drink water when I feel thirsty. Juice count are enough fluid each day. I should avoid water to prevent what? Swelling. If there's no water, less hydration, premature contraction, premature baby. Therefore, any answer choice that said drink, keep on drinking. There's a way you can answer questions. When I answer questions, I try to lead you, let you know that I give you something, I give you a clue. And that's what the NCLEX do. They put the clue in, but if you ignore it, it's your problem. Don't ignore it. The questions say proper hydration. You should not pick an answer choice that does not answer proper hydration. I should avoid water to prevent swelling. Well, you're going to swell anyway, but the question is asking you drink. So how much you want to drink? This is fine. And the last question. And is teaching a client who is 8 weeks pregnant about nutrition. What can you eat? Which of the following instructions should the nurse include? Selected apply. Take a daily prenatal vitamin with folic acid. Limit protein intake to avoid excessive weight gain. Eat a variety of fruits and vegetables. Avoid all dairy products. Choose whole grain over refined grain. Which one is the best answer? Pick an answer. Last question. Let me know your score. Selected apply. Don't over select. instruction to give. 8 weeks. What would you do? We need our prenatal vitamin to prevent neurotube defect. That's good. We cannot limit our protein intake just because we want to gain weight. Baby has to grow. We need fiber to prevent constipation, fruits and vegetables. We need calcium. We cannot avoid dairy product. We need fiber. Whole grain is better than refined grain. So A, C, E are your right answer. What are your score? I know you get 13 out of 13. Thank you for watching. Thank you for subscribing to Adapting Class. And this video help you, just give us a thumbs up and let us know, put a small comment, let us know where you're watching from, and then click on the next video on the screen. It's all maternity. Good luck in your exams and best of luck. Bye.